There have been some quite controversial changes lately in the US in regards to menopause hormone therapy. And I've also noticed it in the kind of social media sphere where there's been some doctor influencers, who are really pushing the use of hormone replacement therapy. And they're giving the impression that it will prevent disease and it will lengthen your life and it has life-changing effects. And while I can totally agree that for some women it can be so helpful if they do have really severe symptoms, because it can be really effective at managing symptoms, but this idea of removing the black box warnings in the US, which have been on there since 2003, and they say that there is a potentially increased risk of cardiovascular disease, blood clotting, breast cancer, and dementia. And while the original research that was done has been criticised, there hasn't been a dramatic change in our understanding since then. We can't say that those risks don't exist, and actually the research does still somewhat support the idea that oral estrogen is associated with increased risk of blood clotting, and synthetic progesterone is associated with increased risk of breast cancer. And there's also this claim often made that HRT will protect you from cardiovascular disease risk. Actually, women before menopause have a lower risk of cardiovascular disease than men. And after menopause, their risk goes up to the same level as men. So are you really preventing anything? I don't really know. Or is it just a phenomenon of the stage of life that you're in? So I just want to stress this point that there is so much that we can do to support women going through this natural transition. It's not a disease, it's a natural transition. And while it can be quite rocky for some women, that's often because they're under a lot of stress. And that is something that we can help with holistically. So in terms of herbal medicine, we have phytoestrogenic herbs, progesterone boosting herbs. We have herbs that are adaptogenics. They help the body to optimize its hormone production and help it deal with stress. We have nervines that can be calming. We have mood boosting herbs. We have herbs that can help with sleep. We have herbs that can help with hot flushes. We have herbs that can help with moisture in the skin. So all of these symptoms can be helped. And while it is possible that a small number of women will need really drastic support, and HRT would be the best option for them, but for the majority of women, you can get great results with holistic support, and it can be more personalized to you. So I just want to stress that the data does not support HRT lengthening your life. All it supports is symptom relief for menopause.